your city, your stories exposed.
I'm very, very lucky to be alive.
We ask the tough questions and get the real answers.
There's a bigger issue.
Because nothing is more important than your health. This is Healthcare Uncovered. Problems plaguing our healthcare system make it far from perfect. Over the next half hour, we look at multiple local issues you face here in Lloydminster. This is Healthcare Uncovered.
It was a bit of an eye-opener.
Public is terrified.
As a parent, it was heartbreaking.
What are you doing, trouble?
A quiet night in for the Semitats. Moving to Marshall half a decade ago, the family has settled into the small-town prairie lifestyle quite nicely. But a diagnosis 3 years ago changed their lives forever.
Our son Andrew in 2009 was diagnosed with multiple sclerosis. So it's been a bit of a battle.
The disease grew so aggressive, the only answer for Andrew, chemotherapy.
Puking, IVs, nurses.
Trips to Saskatoon Hospital became a monthly norm.
We had problems at Lloyd Hospital, and that in itself just kept us going to Saskatoon.
But when money got tight, the family had no other choice. Michelle says the subpar service was inexcusable.
I was told that having my son there for his chemotherapy was a huge inconvenience to them. Now, as a mom, that just about sent me over the edge. They're calling it a huge inconvenience to them. Well, did they stop and think of what type of an inconvenience it is to my son?
And the situation just got worse from there. Andrew is sensitive to needles. At all other hospitals, the staff use a numbing cream before putting in his IV. But Michelle says at Lloyd Hospital, the nurse brushed off her request, saying it took too much time, instead trying to use a needle to inject numbing solution before putting in the IV, completely defeating the purpose.
Incompetent would sum it up pretty darn good. I don't appreciate the treatment we've gotten there.
Michelle says she filed a complaint about the incident, but after numerous phone calls, never received a response. Newcap News contacted the Prairie North Health Region, who is in charge of all healthcare services throughout Lloydminster. It responded simply saying it had no record of Michelle and Andrew's situation. The statement reads, Prairie North Health Region has no record of contact, concern, or complaint in this matter. We regret that this family's concerns have apparently gone unheard before now, and we invite them to contact our concern handling program so that we may investigate and respond. And the Semitat family isn't alone. Many frustrated residents have spoken with Newcap News about their dissatisfaction. One woman, wanting to remain anonymous, says her son's emergency was simply brushed off. She writes, a little over a month ago, I took my son into the ER at around 1:30 a.m. My son is asthmatic and has a bleeding disorder. I took him in because he was coughing so hard he started to puke and was bringing up a lot of blood. I explained everything to the nurse about his condition. 2 hours went by and I asked if the doctor was coming. She shook her head no and said the doctor wasn't coming until 6:30 in the morning. She continues, what happened was that my son coughed so hard he burst a blood vessel in his throat. The doctor was outraged and put in a complaint at the hospital. It was very emotional and scary. Prairie North sent this letter in response. Every patient that presents to the emergency department is important to us. However, the priority of the emergency department rests with critical patients. I want to assure you that a physician is always on call for the ER. However, the physician is not necessarily in the hospital at all times. After reviewing your son's chart, I found no documented bleeding disorder for your son. This mother, so frustrated, saying the nurse simply didn't listen. Her son is now scheduled for surgery at the Stollery Children's Hospital to receive blood transfusions. She says, I'm scared to bring him home because if he has issues with bleeding after the surgery, I'm not sure I would even go to our ER I'd probably drive back up to Edmonton.
It's concerns from doctors too. It's very frustrating. The emergency room is overrun. Nurses, doctors, everyone's frustrated.
Dr. Shapelsky knows all about the inner workings of the Lloyd Hospital with over a decade experience in the ER.
It's frustrating right now. I mean, morale's not fantastic. Patients aren't happy.
And while the Lloyd Hospital just got a facelift, expanding the ER and admitting departments,
I feel our main problem is lack of family physicians.
Dr. Shapelsky says close to half the people he sees in the emergency room don't need to be there, and other officials agree.
For many people that don't have a regular family doctor, their access point is the emergency room, and that's not efficient. It's certainly not cost effective.
We understand that there's upwards of 50% of our residents that don't have a family physician.
The latest census shows Lloydminster's population is just shy of 31,000 people. Compare that to the amount of doctors practicing in the city. According to Prairie North, there are 27 family physicians, 4 general surgeons, just 3 gynecologists, and new this year, 1 full-time pediatrician. And while Prairie North doesn't define how many patients each doctor can take on, with many family physicians not accepting newcomers, it's hard to get the proper care. Coming up after the break, we look at possible solutions to the doctor shortage and how accurate data could be the key to solving some of the city's problems.